Good afternoon. Today is March 1st, 2013, and we are going to talk about canes, walkers, and shoulder pain and back pain. Frequently, we get a lot of new clients who have canes, walkers, different devices that they use to help assist when they've got low back pain. And what I often find is they end up setting their cane so low and their walker so low that they're stooped forward, and they're using their shoulders a lot to help out, which makes them feel stable. But what it does is it ends up wearing on their rotator, and it ends up wearing on their low back just because they're bent over so far. Stooping that far forward will definitely increase wear, tear, and degeneration on your low back. So although it's going to sound really simple, I take most people's canes, walkers, and I raise them 2 to 3 inches sometimes. Sometimes a little even more. But what that does is, instead of being really bent forward where you're just leaning into that thing and just putting all that load into that shoulder, they can still use their walker and their cane, but they've got to be more over their center of gravity, so they'll feel more stable. The other thing that I encourage a lot of them to do, and the people who do it like it, not everybody does it because they just don't want to, but I tell them to go get a walking staff. And when you hold a walking staff, it helps you walk taller and straighter, and it helps your low back not be so worn and torn and so worked and fatigued, and allows your body to actually start healing. And while your shoulder's up like this, there's no wear and tear on your shoulder, as where you're loading into it, there certainly is. So that's a simple, easy, real cheap tip on how to help yourself if you've got a walker or a cane and you have low back pain or developing shoulder pain.